welcome back to Trends and Friends. This week is National Nurse Practitioner Week, and while you might think that you don't know exactly what a nurse practitioner does, you probably have a better idea than you realize. Here to tell us about National Nurse Practitioner Week is Vanessa Balliard. Thank you for being here.
Thank you for having me.
Yeah, nurse practitioners, what do they do? Because people might think, I hear the name, I hear the term, but you don't necessarily know when you're interacting with a nurse practitioner. So tell me what a nurse practitioner does on a daily basis.
A nurse practitioner is an advanced practice provider. A nurse practitioner sees patients, diagnoses conditions. It could be an acute condition such as an infection or chronic conditions such as diabetes, hypertension. Nurse practitioners, we prescribe medications, we order therapies, diagnostics, laboratories, is really anything that the patient might need.
Right, and there are definitely different types of nurse practitioners, right? Like they kind of do everything. Some work with children, some work with babies, other people, work with older people. So it's very specialized, and whoever is, gone through the training and the education, they are most of the time very specifically treating the group of people that they were, trained in their education to.
Correct.
Yeah.
There are a lot of different specialties that a nurse practitioner can work in. I myself am a family nurse practitioner. Like you said, there's those that are work in pediatrics, geriatrics, mental health, women's health, acute care. So a variety of settings in outpatient and inpatient settings.
Okay, so what really, is the difference between a nurse and a nurse practitioner? Because people don't realize, but there is a big difference.
Yes, a nurse practitioner is a registered nurse that has chosen to go back and receive years of additional education and training to become an advanced practice provider.
Okay, all right, and there are obviously a lot of nurse practitioners here in Lubbock and the state. How many nurse practitioners are there in the state and kind of everywhere?
Across the country, there is about 248,000 nurse practitioners, and here in Texas, there's about 15,000, a little over 15,000, and in the Lubbock area, approximately around 300.
Look at that, man! Look at that, and you probably most of the time you don't even know. You might be talking with one. A lot of times you think. This is a doctor, right? Because most of the time you're dealing with or talking to a nurse practitioner, it might be in kind of a clinic or something. Whereas most of the time someone is going to chit-chat with a nurse practitioner or deal or work with them one-on-one.
Probably more so in an outpatient setting, whether that be in a primary care clinic or an urgent care. Nurse practitioners do focus a lot on patient education, so I hope that people will have more of those conversations with nurse practitioners because we really want to promote patients and promote teaching as far as medication and conditions, and just better health outcomes for them.
Okay, and if anyone is kind of wanting more information, or maybe there's a nurse practitioner that wants to get involved in a little bit of a group, y'all have a group here in Lubbock in the South Plains. Tell me about that.
We do. I am currently the president of the South Plains Nurse Practitioners Association. We have a Facebook page, so you can find that on Facebook, and we meet once a month, and we're really doing some exciting things. So I hope if there's any nurse practitioner that wants to be joined at a local level, please contact us.
Okay, well, happy National Nurse Practitioner Week. Thanks for joining us. And if you have any more questions or want any information, you can go ahead and check out that Facebook page just to figure out a little bit more about nurse practitioners. And after the break, how you can learn to cope with grief during the holiday season. That's next.